Hello, hi, I'm Lakita. I'm your nursing student with UTA, working with your nurse Becky today. I'm going to go ahead and close the door, pull the curtain to provide privacy. I'll also wash my hands to perform hand hygiene and grab some gloves. Yes, ma'am, 2 semesters left. I can hardly wait. Could you please verify for me your name and date of birth? Okay, Jane Doe, date of birth 1/9/1974. That's what's indicated on your wristband. And let me check your chart. Jane Doe, January 9th, 1974. Okay, that verifies my chart. And Mrs. Doe, do you have any allergies to medications or foods? No allergies? No allergies indicated on your wristband. And no allergies on your chart. Great. Okay, Mrs. Doe, the reason why I'm here today is I'd like to perform a bubble assessment on you. It's an assessment that we perform on all of our postpartum moms. I'll basically be listening to your heart, your lungs, checking your incision. It's basically a overall assessment, okay? Is that okay? Great. Now, before we begin the assessment, I do want to ask, do you need to empty your bladder or void? Oh, you went before I came in. Great. Okay. Now, I also do want to just ask, how are you doing? Okay, you're good. Okay. And are you bonding with the baby fine? Or do you have any anxiety about being a new mom? Any depression? Okay, everything's well. Great. Okay. And also regarding pain, are you in any pain? Could you rate it on a scale of 0 to 10? No pain? Okay, awesome. Okay, so what I'm going to do is I'll go ahead and begin the assessment by first, again, listening to your heart, your lungs, and your bowel sounds. You can just lay here comfortably, and I'll let you know if I need you to change positions or do anything, okay? Great. Okay, so I'm going to go ahead and put on my stethoscope. And again, you can just lay there comfortably. Now, I do want to say that when I do assess you, I will have to put my stethoscope directly on your skin, but I will keep you covered up and maintain privacy, okay? Great. Let me get started. Okay, I'm going to clean my stethoscope with the alcohol pad. Okay. And I'm going to go ahead and begin by listening to your lungs. Now, as I move my stethoscope, you can just breathe in and breathe out deeply, okay? All right. Breathe in and out. Right. Okay. Right. Okay, I'm also gonna listen to your lower lobes. On both sides. Okay. Lungs are clear in all fields. Now I am going to listen to your heart, and you can just breathe normally for this, okay? So I'm going to palpate. Okay. And I'm going to listen to your second intercostal space, the aortic area. Right sternum border, second intercostal space, left sternum border, colonic, Erb's point, third intercostal space, tricuspid, fourth intercostal space, and sternum border, and mitral valve with intercostal space. All right, And since I've listened to it, I'm gonna also flip with my bell and listen to it backwards, okay? Okay, awesome. Okay, now again, your lungs are clear in all fields, and S1 was heard loudest at the apex, S2 heard loudest at the base, no murmurs heard. Now I am going to also listen to your vowel sounds. Just wanna button your, I won't button it, but I will. Now, before I listen to your vowel sounds, what I'm going to do is I'm going to step back and I'm going to assess your abdomen for any distensions, no distensions, no pulsations. Okay? And then I will go ahead and listen, beginning in your lower right quadrant. Okay. I'm gonna cover you up here for a second. Take these off. Okay, so vowel sounds were normal, active in all 4 quadrants. When was your last vowel movement? Today also? Okay, good. Okay, and any change in that? Anything I need to know about? It was fine? Okay, good. Okay, now, what I'm gonna do now is I will inspect your breasts, and I'll be inspecting for symmetry, signs of engorgement, or redness, okay? Also checking to make sure that they're firm, there's no nodules or no tenderness, okay? All right. So, keep you covered, and I'm gonna check, palpating. Okay, I did also assess the nipples for cracks, bleedings, or potential lap issues, and I do not see any. Your nipples are intact. They are soft and non-tender, okay? All right, so I'm gonna go ahead and button your shirt now. That way, if we move my fingers. There we go. All right, so I do want to ask, are you planning on breastfeeding? Have you decided? Okay, unsure? Okay, well, your body doesn't know whether you're gonna breastfeed or not, so it's gonna make milk anyway. Usually around day 3 to 5, your breasts tend to get full, firm, and tender, and that's a sign of engorgement. Now that is the worst part, but it's temporary. If we don't stimulate them, it usually settles about 24 to 48 hours. The whole strategy, if you decide not to breastfeed, is pretty simple. You just support them, leave them alone. You wear a snug, well-fitted bra, sports bra, around the clock, even at night if you can stand it, okay? All right. So also, you mentioned that you went to the restroom before I came in. Was there any burning or discomfort when you went to the restroom? No? Okay. And regarding the frequency, are you going around the same time that you, same amount of time or same frequency that you were before? Is it more or less? About the same? Okay. Well, I do want to say we never want you to hold it. We want you to avoid every 2 to 3 hours on a schedule, urge or no urge. The part that surprises a lot of people is after delivery, you may not feel the urge to go, especially if your bladder's full. Between all the swelling down there and the numbness from your epidural, your body's signal is turned way down, okay? So we don't want you to wait until you feel like you need to go. Try to go every 2 to 3 hours whether you feel it or not, okay? Yeah. And the reasoning behind that is that when your bladder is distended, it displaces your uterus. So, and basically a displaced uterus can't contract effectively. So that leads to increased bleeding and also clots, okay? Yeah. Okay, and then are you passing gas? Okay. Okay, and again, I did assess your abdomen and there was no distension, okay? Okay, so now what I'm gonna do is I am going to check your upper and lower extremities, okay? And basically I'll be inspecting those just to make sure that there's no redness, there's no swelling in those, there's no warmth, and just checking your skin temperature. So just gonna check your skin temperature. I don't see any redness. Okay, and I'm gonna check your radial pulses. Okay, and that's a 2+ or a 3+. And I'm also gonna check your capillary refill bilaterally, okay? Okay, capillary refill, less than 2 seconds. Okay, and now I'm gonna check your lower extremities. Pretty much the same thing, checking for skin temperature. It's warm, no pretibial edema. Okay, and I'm going to check your pedal pulses. Those two are 2+ out of 3+, and then I will check your capillary refill bilaterally also. And that is also less than 2 seconds. Okay. All right, got you covered back up. Okay, I'm also going to assess your IV site, okay? Since I'm over here now, it looks like you have a 20-gauge IV in your right AC, and that IV is clean, dry, and intact. I don't see any redness, no swelling, no signs of infiltration. What I'm going to do is I am going to untape this just so that I can check its patency. I brought some supplies here, and I am going to remove your curious cap. I'm going to scrub it still 15 seconds. Okay, and then I brought some normal saline solution here. I'll uncap this, remove the air, and I will attach that to your IV port. Now the first thing I'm going to do is pull back to see if I get blood return, okay? And I am getting blood return. Okay, and now I am going to push some fluids through just to clear the line and check the patency, okay? All right, and while I'm pushing these fluids through, I'm also going to be assessing your site to make sure that there is no signs of infiltration, no redness, no swelling. And I'm going to be checking my patient as well to make sure that there is no change in level of consciousness. And the patient is doing overall well. All right, so your IV appears to be patent visually, and the assessment, I'm going to go ahead and retape it back up in your J so that it's out of your way, and make sure your line is closed, okay? All right, let's set over here. Okay, so now that I have checked your IV site, that is out of the way. I am going to now check your fundus, okay? And so your fundus is your stomach, your abdomen rather. And so I'm gonna palpate it just to determine whether it's firm or boggy. Now, what we always want a firm fundus. So I'm gonna just press on your belly just to check your uterus. It's gonna be a little bit uncomfortable, and I'm sorry, but it's important that we ensure that your uterus is firm. We want it to feel somewhat like a grapefruit. So when it's boggy or soft or spongy feeling, that means that the blood vessels where your placenta were, they'll stay open, and you tend to bleed more. So if we need to, we can proceed with massaging it to get those blood vessels to clamp down and stop that bleeding, because that bleeding can result in postpartum hemorrhaging. Okay, all right. So I'm gonna again keep you covered up. And again, I've already assessed the abdomen for distension. There's no drains, there's no lines, no pulsations. Okay. And your abdomen or bundle is non-distended. It's normal. And then now what I'm going to do is I am going to assess your perineal area. I'll be inspecting your pad, as well as I will be just inspecting overall your perineal area, just to make sure that your incisions and everything are basically, incision site is okay. Okay, so I'll go ahead and pull back your pajamas, nice pajamas by the way, I really love them. I'm gonna pull that back. And what I'll be using is the standardized assessment called the RETA, and basically that's stands for redness, which is normal around your laceration site. Edema, which is also swelling, and that is also mild edema is also something that is normal within the first 24 to 48 hours. Ectomosis, which is like bruising, and we do also expect small amounts of bruising, any discharge or drainage, and also to make sure that your wound edges are still together and approximated. Okay, so I'll be checking all of those things. All right. So I'm gonna pull back your underwear here. Okay, and I am showing that everything is intact. Now your lochia looks to be scaped and in the rubia phrase. Okay. Cover you back up. Okay. Now the last thing I want to do is I'd like to turn you on your left side, and I'm going to check your area where your I'm going to check your to make sure that you don't have any hemorrhoids, and then I'll also inspect the area where you had your epidural. Okay, so I'm going to turn you on your left side, and I'm going to flex your knee towards your chest. Okay, and again, I'm maintaining privacy. There we go. Okay, so pull this up again. Okay, I am inspecting the area for your epidural, and that area looks like it's intact. There's no redness, no swelling. I'm gonna pull your underwear down, and I'm gonna pull your glutes apart, and I will assess if you have any hemorrhoids, and I don't see any hemorrhoids. Everything looks intact there, and a episiotomy looks good both ways. Okay. Now turn you back over, get you back comfortable. All right, and then I'm gonna remove these gloves, get some hand hygiene here. Some more gloves. Okay, so I'm gonna get you back comfortable here. I am going to lower your bed to the lowest position. Make sure that your two rails on your left side remain up, which they are. this concludes the bubble assessment. Mrs. Doe, excuse me. I thank you for allowing me to complete the assessment. I'm going to bring your tray table over here so that all your belongings are close to you, and I'm going to give you your call button in case you need to call me, okay? Do you have any questions for me? No questions? Okay, all right. Well, I do again want to thank you for allowing me to complete this assessment. If you have any questions, please don't hesitate to call, okay? All right. I am going to remove my gloves. That is the lowest position. Call light, brakes are on, all of the rail is up, belongings are by the bed. I'm going to remove my gloves. I'm going to perform hand hygiene again, and I am going to get my items and exit the room. Hand hygiene again on the way out.